Authorities are continuing to investigate two alleged poisoning incidents, and this after 5 children died, 3 of them allegedly after consuming biscuits bought from a local spaza shop, and 2 others after consuming food believed to have been bought from a West Rand taxi rank. Well, 2 other children who also consumed the food product were transported to hospital, and traces of organophosphate, a chemical also found in rat poison, have been found in samples of these foodstuffs. Now, authorities say more samples have been taken to the lab as investigations continue. But I'm now, of course, joined, just to give us an update on this, by Mr. Motalatale Modiba, the Gauteng Department of Health Chief Director. Mr. Motalatale Modiba, thank you so much for your time and a very warm good morning. I mean, not the news that, South Africans wanted to necessarily wake up to. Quite devastating, I mean, to hear that innocent children, unsuspecting, consumed foods from a local spaza shop or even a taxi rank, and now have lost their lives. What information do you have? What are the merits of the case that you have at your disposal?
Thank you, Timel. I think what we just need to maybe highlight is that at the moment we have our outbreak response teams which are on the ground. They are continuing with advocacy work, social mobilization, and basically raising further awareness. So within the team, you've got various people that deal with different things, surveillance, they'll deal with different components around this particular incident, and others obviously are focusing on the part that relates to the testing, the taking of the samples, and so forth. So the teams are continuing to be on the ground. They are at Naledi, they were also at Protea as well, to try and engage with communities there, but also to engage with those that are running establishments within the particular areas, including in the Western area where we have the incident that you spoke about earlier on. So we are obviously intensifying the advocacy work, the awareness work, but also even the inspection in some of these facilities or establishments to ensure that the issue of compliance are adhered to at the moment. But we are also, I think, emphasizing safety messages to communities, because you to call that the issue around where you buy your food and the condition in which the food is in is quite important, so that if we're going to be able to address this current challenge that we're facing. It's said that obviously at this stage we have lost some lives, and it's a very painful period for the affected families, and we're trying to work with them as well by way of providing counseling to those families. But most importantly is continuing with the awareness drives, and we are now working obviously with the local authorities who are responsible in terms of implementing your bylaws, implementing the laws that are relevant insofar as environmental health in our communities is concerned.
Right. As it stands, how many children have been affected? I'm talking here in terms of fatalities as well as those in hospital, those have been discharged. Are you able to give us numbers updated?
In terms of fatalities, we have 5 children. Is the 2 from the Naledi incident of the first. Then we've got the other 2 from Western, and then we learned yesterday of another incident in Protea. That incident, it looks like the death would have happened on Tuesday or so, and at that time, obviously, the parents just thought it's just one of those unfortunate incidents, but did not really connect it to what is currently happening. So when they saw on the news that there are these other cases, they then came forth and said, we also have our own 14-year-old who would have bought some Simba chips, in some chips basically in one of the local spaza shops, and they consumed that, and unfortunately they've since passed on. One child also was sickly from that, but they're doing well at home. In terms of the other children from the incident in Naledi, we have 2 that the 1 3-year-old on the same day was seen and released, and they were never really admitted. They were just observed. And then there were two who were being treated at Chris Hani Bara, and I think one was doing fairly well. In fact, just prior to this interview, I was trying to get an update. Unfortunately, I couldn't be able to reach the colleagues just to check as to whether that child has been released. But there's one that is still in was receiving care in ICU. They were stable, but they were in ICU. And then we have the from the Western one, the two children that were taken to Leratong Hospital as well. So we will get obviously an update there later as to whether they have been discharged or they still remain in hospital.
Yeah, and I mean, we're also having this conversation, as you mentioned earlier on, Motalatale, that awareness is what you are focusing as well on to avoid any more fatalities and, you know, children or even adults are falling victim. Because from the information we have at our disposal, organophosphate, I'm hoping I'm pronouncing it correctly, it's found in rat poisoning, right? And one would wonder how that got itself into foodstuffs, in food that is accessible to community members to buy at Spaza shops or even at a taxi rank, probably at a very cheap price, because we know that most of our community members are currently, you know, negatively impacted by the cost of living. So, you know, cheap or you know, affordable biscuits or foodstuffs would be probably a more cheaper option than an expensive one. So that awareness being particularly important to raise, because we can also see the protests in some of our communities, you know, at the announcement of these children's deaths, that they have been buying what they call fake food from some of these puzzle shops. So they're going into some of the owners of the shops, not necessarily abiding and complying with the regulations on selling, you know, food that is of quality and that is consumable and not, obviously, deadly to anyone that it's been sold to.
Look, at the moment, because we've taken some of the food samples to the food lab, we're waiting for those particular results. We don't want to speculate on exactly what the source would be, but we're expecting that in the next week or so, we should get those particular food lab results that will then tell us exactly what it is. What we do know is that there's a common pattern here where the children would have eaten sweets or chips bought from local vendors or local spaza shops and so forth. The issue that you are raising around rat poisoning and so forth, look, we're not ruling out any possibilities at this stage, given that we know circumstances that under which communities live and so forth. And we know that in many of our families, from time to time, we do this infestation processes where we're trying to get rid of cockroaches, rats, and so forth. But it's the correct way of being able to do that. And I think part of the work that needs to happen now is just to say the other awareness is the issue around how do we safely, address issues of rodents, issues of insects in our homes in such a way that we don't contaminate the food that we have in our own homes. But also it is the issue of saying, in terms of the handling of food, the storage of food, the importance of also being able to check your expiry dates when it comes to food labels. That is quite important in terms of empowering communities to be able to know what actions to take. But we're also saying, when you go to your local establishments and you buy whatever food items, check the labeling, check whether the food is not expired. If you're buying a tin of beans or fish and you see that the can is already looking like it has fallen off many times, it's bended or it's damaged, or the labeling is peeling off, or sometimes the food pack is opened, rather be err on the side of precaution and not really buy that type of food.
Right.
But there's an issue as well around the responsibility, holding accountable those that are running these establishments to say they have a responsibility to ensure that the type of food stuff that they provide to communities is safer. And I suppose one of the things that needs to happen now is to actually track as to where are these traders sourcing their products.
Right.
Because if we're able to do that, that will assist a lot in terms of being able to trace, because we can't have so many children at a go at different places, yes, but all similar type of what do you call scenarios where they would have bought sweets
Right.
or chips and they end up falling ill. That then says we must be able to track down the source as to where are these traders sourcing their products
I
from
agree with
and
you.
the condition under which these products are being kept.
Absolutely, because that track and tracing could also assist in also establishing if that best before date Motalatale is also not manipulated. Because I can check if my can of beans or fish has expired or not. But if the date tells me that it's expiring a month from now, 3 months from now, how indeed do I know that it hasn't been manipulated? So I suppose the track and tracing in terms of checking even with suppliers, equally important, doing those background and compliance checks. But thank you so much for speaking to me. That's all the time I had with you. But thank you so much for just speaking to me regarding this tragic case of young children losing their lives, allegedly due to, of course, them consuming foodstuffs that had been laced with poison. Motalatale Modiba, Gauteng Health Department Chief Director, speaking to me, telling me about the latest number that they have at their disposal as far as those children that have been affected, but also what they're doing now as the Department of Health, continuing on with the investigations, the testings. Certain, foodstuffs have been taken to the lab just to ascertain, indeed, what exactly has been the cause of these fatalities.